Hello and welcome to Learn from the Case. Today I want to awaken your curiosity with a new neurological case. CADASIL, Cerebral Autosomal Dominant Arteriopathy with Subcortical Infarcts and Leukoencephalopathy. This is CADASIL Part 2, the last one. You can even see the first part in the previous video. Management of CADASIL. There is not a specific treatment to halt this genetic disorder. Individuals are given supportive care. Migraine headache might be treated by different drugs, and a daily aspirin might, in theory, reduce stroke and heart attack risk. Drug therapy for depression might be given. Affected individuals who smoke should quit, due to at smoking alone confers a threefold increase in stroke risk, as it can increase the risk of a stroke in CADASIL. Other stroke risk factors such as hypertension, hyperlipidemia, diabetes, blood clotting disorders, and obstructive sleep apnea also should be properly treated. CADASIL with a stroke is typically managed like sporadic stroke patients. They are placed on antiplatelet drugs such as aspirin or clopidogrel. However, the efficacy of this approach is uncertain because the pathophysiology of CADASIL is not clearly established, and ischemic events are not explicitly linked to a thrombotic origin. Moreover, numerous studies identify microhemorrhages in CADASIL patients, calling into question the safety of antiplatelet therapy. Due to these safety concerns, CADASIL patients who receive anticoagulation for other indications, such as atrial fibrillation, should be closely monitored for signs of intracerebral hemorrhages. In practice, most CADASIL patients without evidence of microbleeds are given aspirins. The potential benefit and risk of thrombolysis also remain uncertain. Despite the presumed risk of hemorrhage, there are some reports of CADASIL patients with marked improvement following administration of intravenous tissue-type plasminogen activator in the setting of acute lacunar stroke. The other manifestations of CADASIL, namely migraines and cognitive decline, are treated with standard medications. Acetazolamide appears to be particularly useful for migraine in CADASIL patients. While evidence for acetazolamide usage is based on observational reports, its use seems logical given that hypoperfusion is characteristic of CADASIL. Acetazolamide may also be helpful against seizures, although this is not entirely enough, and other treatment should be indicated for the management of seizure. But it's good to keep in mind that this effect was known since a long time, and recently studies were published showing that acetazolamide acts as a non-competitive inhibitor of carbonic anhydrase, of which there are several subtypes in humans. Cholinesterase inhibitors, such as donepezil, have not been found effective in improving overall cognitive function. However, there might be benefits in executive function. Prognosis. Symptoms usually progress slowly. By age 65, the majority of persons with CADASIL have cognitive problems and dementia. Some will become dependent due to the multiple strokes. The National Institute of Neurological Disorder and Stroke conducts stroke research and clinical trials at its laboratories and clinics at the National Institute of Health, and through grants to major medical institutions across the country, USA. Scientists are currently studying different drugs to reduce cognitive problems in patients with CADASIL. Researchers are also looking at ways to overcome an overreaction to hormones that lead to high blood pressure and poor blood supply in patients with CADASIL. A few things regarding acetazolamide. Mechanism of action. Acetazolamide is a carbonic anhydrase inhibitor. That means this drug works to cause an accumulation of carbonic acid by preventing its breakdown. The result is lower blood pH, more acidic. Traditionally, acetasolamide's efficacy has been attributed to inhibition of carbonic acid in the kidneys, resulting in bicarbonaturia and metabolic acidosis. The result is offsetting hyperventilation-induced respiratory alkalosis. However, there are studies now that talk for other factors that are likely to play also a key role in the drug's efficacy. Such factors include not only metabolic acidosis resulting from renal carbonic acid inhibition, but also improvement in ventilation from tissue respiratory acidosis, improvement in sleep quality from carotid body carbonic acid inhibition, and effects of diuresis. Absorption. Acetazolamide is rapidly absorbed from the gastrointestinal tract. Maximum plasma levels of the drugs are reached 1 to 3 hours after oral administration, and maximum blood concentration approximately 1 hour later. Metabolism. Acetazolamide does not undergo metabolic alteration. Excretion. Plasma half-life is 6 to 9 hours. Renal excretion is the primary route of elimination. This is a very old medicine that is used to treat, improve several ailments. Nevertheless, usually not as a single treatment. We saw it can treat, at least in part, migraines and seizures. A recent study showed that acetazolamide can improve prognosis of patients with colon polyps and cancer. As a result, acetazolamide treatment reduced the total number of intestinal polyps by up to 50% compared to the control group. In addition, the acetazolamide treat group had low cell proliferation and a high apoptosis ratio in the intestinal polyps epithelial cells. I leave you here a link if you want to see it. Well, that was all what I wanted to tell you now. Thank you for your attention and be well.